Before the pandemic, the district was working on all cylinders. Everything was going well. We were going to be all A schools, high graduation rates, low dropout rates, and then the pandemic hit.
This is the day everything changed.
We'll all soon be under orders to stay home.
Suddenly making the call to close public schools, turning to remote learning for now.
All of that change, the lack of routine, is taking a toll on their education.
And that led to a significant increase in depression and anxiety symptoms for teens.
When we decided, along with everybody else, to shut things down because of COVID, no one really knew what that meant. It just exposed what we need to be more cognizant around.
They were dealing with things with COVID, the pandemic, on death, and people losing their jobs, and it created this really social-emotional gap.
Increased levels of anxiety, depression, suicidal ideation.
We didn't know how long this was going to last, so we wanted to do some back design preparation. So when we started in person, that we started off strong.
Mental health and social emotional wellness.
Tonight, the Tempe Union High School District's governing board voted to adopt a comprehensive mental health policy. And it was initiated by one of their youngest ever board members.
Going through a lot of my own mental health struggles, my freshman and sophomore year of high school kind of really opened my eyes to a lot of the struggles that everyone is facing, but particularly, our youth population right now. Periods of just chaos and division, I think, contributed to a unique situation for young people. And so having a policy like this that really centers around student voices, identifying structures and resources in place to make sure that we are meeting their needs. We had a student representative from every one of our schools, and they were actively involved in writing the policy that we have in place today.
We're raising money for Teen Lifeline to help spread mental health awareness and for suicide prevention.
We don't just say we value the whole child. We put our money and our resources around that because our kids deserve that. They have one shot in high school, and if we don't get it right and always strive to do our best, then we're not doing our job.
We needed more human capital, so we needed to hire the counselors and the social workers and the psychologists and Care 7 social workers that have a master's level degree. And then the partnership with Care Solace was an integral part of our plan to ensure that we can get our families immediate support. Even my own family, we struggled during the pandemic, and it was important that we'd get my children the social emotional support, the counseling that they needed. And we were waiting 4 to 6 weeks. With Care Solace, we're able to give that immediate support. We don't have to do the phone calls and wait.
It definitely brings an added layer to our staff where they're not trying to spend all of their time trying to connect people to resources. They can do almost a one-stop shop.
There's been a lot of wait time before you can reach a therapist, and things can really worsen in that time. So being able to be that person that connects them to the resource such as therapy and Care Solace is just amazing with how quick it is. So really the benefits of Care Solace, I can see it happening in real life.
One of the biggest issues that I think we're facing in this battle is the stigma that surrounds mental health. To show that it's a priority of our district in and of itself has made a big difference. But really demonstrating to students the new resources that we have available has made a big difference in students feeling more comfortable being able to go out and seek those resources in the first place.
I believe wholeheartedly that if public schools don't embed and include some level of social emotional wellness in their strategic plans, they're not meeting the needs of the whole child in their schools. I would highly recommend involving that key deliberate aspect of social, emotional, and mental well-being into their planning. And Care Solace has been an absolute gift for us in helping us achieve our goals for our students and staff.
We're all in this together, and it really does take a village.